Welcome back to Divided We Fail, a Front Porch political chat podcast. It's Travis, and today we're tackling one of the most pressing and, well, let's face it, sadly divisive issues in our country: healthcare. Now, I know what you're thinking. Not another healthcare debate, right? Here's the thing. Today, we're not diving into the usual back and forth of political talking points. We're setting aside the shouting matches and focusing on what matters most: actual healthcare policy. What are the real, tangible solutions to our healthcare crisis? How do we increase access and affordability without breaking our current system? And most importantly, how do we get past the politics to create meaningful change? Whether you're in favor of universal healthcare, a free market approach, or something kind of in between, today's conversation is about exploring those options and finding common ground. No labels, no identity politics, just real talk about real solutions. So pull up a chair, take a deep breath, and let's get into it. Because when we focus on policy over politics, we just might find the answers we've all been looking for. Welcome back to Divided We Fail. We have a new host. We are now a trio. And I will let Cody take it from here and kind of give you his backstory before we dive into today's topics.
So, my name's Cody. I am a 32-year-old white male who lives in central New York. I own a house. I have an 8-year-old. And let's see what else. I have a master's degree. I'm trying to think what other things you guys said. I mean, I think that pretty much covers it. Grew up in northern New York. First person in my family to go to college. Yeah, I think that about sums up the background.
I would say that you would also classify yourself as lower middle class. Being raised wise. Right now, I wouldn't say
yes.
that. But
Right. Yes.
now I would say that you probably consider yourself to be middle class.
Probably. It fits, even though it doesn't necessarily feel like that, because $70,000 in 1990 compared to now is very different.
We got an economics epi coming soon enough. We'll get into that. Yeah, so we're going to talk about a topic. So actually, fun fact. So for a little background on how Cody came to fruition, we actually originally reached out to him because obviously with the healthcare episode, he is a mental health counselor, and so we were like, that'd be a nice perspective to bring into the whole mental health perspective because he deals with insurance companies and things like that. And then he was like, what if I just came regularly? And I was like, that's cool. And James was like, that's cool. So yeah, now we're a trio. We love it. We like to have it. He's a unique perspective. I would say that he probably shares more with me than James, but we're not 100%. So now we're covering all of our bases. All we need to do is get, I don't know, a European or Canadian in here, and then we'll have everything covered. So let's dive right into it. So the first thing, obviously, we're going to work our way down into more. We're going to start broad and work our way into like a more pinhead kind of discussion, and then we'll finish out with what we think we can do and how we can progress further. So we'll start out with the current state of healthcare in the U.S. and I specifically would like to address what each of us kind of thinks is the key issue that would be on our minds as voters per se with what we think is wrong with healthcare in America. I mean, I'll start it since I'm the one chatting, but number one is going to be universal access. I think that given my background in game design, I would say that there's a paywall in healthcare. There are people in every spectrum of life that either don't get regular checkups, they don't get procedures that would necessarily increase their quality of life. They don't get medications that could be pivotal to ensuring they live a healthier life. I know for a fact that there are elderly people that have to choose between medications and food. And those are all things that I find to be ethically and morally reprehensible in the wealthiest country on earth. I do note, as somebody who has been next to and been a part of public paying systems like the VA, like Medicare, like Medicaid, that there are glaring issues with that system as well. But the number one issue on my mind as a voter is just simple access and cost. You shouldn't have to go into $30,000 in debt because you had a gallbladder emergency. You know, there should be fail safes, in my opinion, and you also shouldn't have to choose between your blood pressure medicine and your food. So that's my take. Feel free to jump in.
Yeah, I mean, there's there's better ways. I honestly, I think hospitals need a menu. Um, you know, you go in knowing this is how much this costs. But my belief is hospitals, um, big medicine companies, like even though you'll find out later on anyways, I lean right. There's these big companies are they're operating almost on like a strictly profit scale. Like we made this much last year, we need to make this much whatever. Um I don't think, and we're going to go over later, well, Cody's going to go over later the salaries for some of these guys. I think you would see America net benefit from all medical hospitals, all that being non for profit. So you're still paying salaries. People are still getting paid, but at the end of the year, you're not making billions and trillions. I think you would see not only the quality of healthcare go up, but then your medical advancements, now you're getting more money thrown at those, you know? So it's a thing where we're taking away money from medical advancements, which I don't want to do because America does a really good job at medical advancements, and they're not number one, and they're not alone in that. But I feel like that is just as important. So if you make it not for profit, now you're still paying salaries and cap these guys. There's no reason they should be making millions upon millions of dollars each year, but then raise my premiums. It makes zero sense. So I think that, and it should be all of their income should be like federally reported, because once you put the accountability on these people and bring it to the front line so people can see, I think you'll see a lot of people pissed off and looking for options where the CEOs aren't making millions of dollars each year and then jumping your premiums. So you're paying an extra $1,000 a year. It just doesn't make sense. And there's only one way to put it, and that's corporate greed, which is the downfall to capitalism, in my mind.
Well, I think one of the things that you said very nicely, right? Like capping a salary and not giving the CEOs bonuses and increasing premiums, or doing what I would imagine would be the healthcare equivalent of shrinkflation, where they change policies or take away policies that are affordable and help people get quality care from smaller employers that don't have over a certain number of employees. So, or even in the negotiations with hospitals and other in-network services about reimbursement, not going in and lowballing and saying, oh, we're going to give you a 5% decrease in what we reimburse this year just because we lost money last year. It makes no sense to give a decrease in reimbursement when everything is more expensive than ever, and quality healthcare needs to also be considered as not a luxury, but a basic human right, where hey, this is what I need to survive and sustain.
Mm-hmm.
So to give some of the numbers, where is it? Excellus Health Plan, which is affectionately Excellus Blue Cross Blue Shield in New York. The CEO, James Reed, in 2021 made $1.8 million. In 2022, he made $2.2 million, and in 2023, $3.5 million total compensation. So that includes bonuses and other things. And he's not even on the higher end of this scale. There's a company called Guidewell Mutual Holding Corp. CEO in 2021 made 1.3 million for salary alone, 4.75 million bonus. Other compensation $18.52 million. Total compensation over $24.5 million. It's insane. There's no way that makes sense when people are going without insulin, going without other life-saving drugs, or even going without adequate mental health care. The other part of this is that I live in a city where there's 4 hospitals and only 2 of them are equipped to deal with severe psychiatric patients, and the 2 of them that don't do it well because they're severely understaffed. They have patients sleeping on beds in the hallway. For someone who is having a schizophrenic break, that is super traumatic and not even remotely close to safe. I think my biggest concern is quality healthcare isn't accessible at all, whether that be affordable or within driving distance. Because the other thing I think about is maternal mortality rates in women who are pregnant and or giving birth. Sorry, correction. People with uteruses who are pregnant and or giving birth. It's a high rate, and part of that is not having access to quality labor and delivery care.
Yeah, and to bounce off of that, I just pulled up some statistics from Harvard Health, and we obviously have been kind of dabbling into the expensive or the expense nature of healthcare, the overburdening of the patient to fill the coffers of investors, shareholders, CEOs, CFOs, and that kind of stuff. And so we obviously we have the highest healthcare costs in the world. I don't think you guys are stupid. I think you know that we do not have the best healthcare outcomes in the world. We actually have, of all developed countries, we have the lowest life expectancy. We have the lowest performance on a variety of health outcomes like heart disease, obesity, mental health issues. Like there's a plethora of things that come into play, and the number one issue that at least Harvard Health attributes to that is high administrative costs. What do administrative costs qualify for? Well, we just talked about that. The inequity involved with United States healthcare is exactly the situation that you were just talking about, where we got people sitting in hallways that are having mental health breakdowns. We've got mothers who can't be cared for because they don't have access in their, I wouldn't even say rural, in their not big enough city to have a trauma or a level 1 trauma center. And all of these issues are a direct correlation to the fact that if we have inequity built into our healthcare system. And now the Affordable Care Act tried to make gains in that aspect, but there's a lot of broken situations. And one thing directly correlated outside of healthcare outcomes, and I'm pretty sure, Cody, you as a mental health counselor could probably back this up, and that's that financial insecurity leads to other healthcare outcomes that are negative as well. For instance, you have obviously, if you're not making as much money or you don't have as much spendable money, you're not getting as good of food. You're stressed out about money, so you're not getting good sleep. You're probably overworking. There's a plethora of negative healthcare outcomes that can occur from that. And one example that I just saw that just literally dropped me to my jaw hit the floor. Average income in the United States as of Q4 2023, according to the National Bureau of Labor Statistics, was $59,384. That breaks down to $4,948.67 before tax, which we all know it's the tax. So realistically, if you take away 24% of that, we'll call it $4,000. So you get $4,000 take home. Out of that take home, because in most situations your insurance is employer supplied, so it comes out of your paycheck. The average monthly cost for a family of 4, and that's the reference point we use. I realize that the U.S. family rate now is like 3.7, but whatever. $1,437 a month. So that, boom, right there takes over a quarter of your monthly salary out of your pocket without you even getting to have a say about it. It's gone, and that doesn't even account for any additional costs, like things which I cannot describe. I can't understand why teeth and eyes don't count as part of the healthcare plan. I never understood why those specific body parts get their own insurance plans, but we live in a world. So that's another factor. So you're taking a quarter of your income. You are paying into a system in which you cannot readily use by paying into Medicare and Medicaid and Social Security with every single check. So that's an even bigger chunk of your income. It cuts into the fact that, other costs are up. So now we have exorbitant healthcare costs. You don't want to really go to do anything besides your annual checkups, because on top of that $1,500 a month that you're paying for insurance, you can't even really use it until you meet your deductible. So if you do have to get a CAT scan or an MRI or what the fuck is the one they do with the babies?
Ultrasound?
Yeah, ultrasound.
Sonogram, ultrasound, yeah.
Okay, yeah. So any of those things, you don't want you turn them down from your doctor because of the fact that you're going to have to pay out of pocket in essence, because you probably, in order to make your insurance affordable, probably have a higher deductible. You're talking $2,500, $5,000. I'll use a personal example. My nephew he has spina bifida, so he has constant medical care. He is covered under my sister's insurance. There are certain assistance programs for Medicare and Medicaid, but for the most part, it's them on their own. And if he has to get, usually by February, and their insurance resets in December, usually by February they have maxed out their deductible, which means my sister, with no fault of her own, by just having to have a child with a disability, has an extra $10,000 expense put on because of the fact that she has to meet her deductible with her health insurance. And so you can only imagine what her actual premium probably is because of the fact that she's in a high-risk household. And so I don't ask that question, but I just know that healthcare costs for them are just completely out of whack. So it just goes to kind of hammer home in the system that as we've discussed, that there's just so many broken aspects to the system. Now, to kind of jump into the next section of the current state, I think, James, you tapped on a pretty specific scenario that I love it. I like the idea of having non-for-profit healthcare institutions, but I think that leads to the current state of political gridlock, because one of the main issues that people were coming to, we think about Obamacare when it was coming out, they were saying you weren't going to have your doctor anymore because there's no way your doctor was going to stay on for the ACA insurances because they wanted to get paid, and that people come to the U.S. because they're going to make good salaries as doctors, blah, blah, blah. Now, I understand that fiscal management and funding of programs is a story in and of itself, but that you come from the right-hand side of the aisle and you know that it's very much the side of limited spending, small government, that kind of stuff. I would like to get your take on how you think that could be sold to that side of the aisle, because I know that you said like in this particular instance you kind of lean left in this topic, but obviously you have a lot more you have a lot more right leaning people in your life that you probably have bounced ideas off of and heard discussions back that unfortunately I do, because usually I just get told to shut the fuck up. But I would like to hear what you kind of what you hear from people as far as when you say things like, what if healthcare was not for profit? Like what are you getting back from people?
I think when it comes to, real quick before we jump into that, I want to jump back to something Cody said.
Uh-huh.
When it just because I don't want to let that topic slide by. When he was talking about how um the hard part with finding something that's good, affordable, and close to you for doctors, that is the truest thing in the world. I think you'd have to look at it and say, do I want quality and affordable? Do I want, and that's not even talking about, that's assuming that you can get in. Um, I just want to draw off a personal experience real quick. I don't remember the exact year. It was a couple years ago. But my mental health, as Trav, you know, I think we've discussed it before a little bit.
Mm-hmm.
Um, I'm diagnosed with PTSD. I have PTSD. I deal with it. You know, I don't want pity or anything for it. Like, it is what it is, and I've learned to live with that. But there was a time where I needed a therapist, and I needed a therapist then. It was an issue. I was missing work. I was, in the process of getting on medications. I was dealing with all the feelings and all the nightmares and stuff that I had previously dealt with, and luckily had medicated that worked. When I was calling around to find a therapist, and it wasn't even that there wasn't any near me, the wait lists, they said it's going to be 3 to 6 months. Now, that being said, it wasn't serious enough to where, it was going to lead to self harm, or it was going to be like an issue that happens, like that people actually experience. They told me 3 to 6 months. Imagine, and like I put myself in the shoes of somebody who is going through it worse than I was. I say luckily, but it sucks. Luckily, most of mine was anxiety attacks and constant anxiety, and I could deal with it, but I needed somebody to talk to. Getting into a therapist, it was near impossible. It was on the verge of impossible. Um, and that is problematic because in my situation, I don't know if this is going to get, you might have to bleep this out, but I wasn't suicidal or anything. But if somebody was, if they were in my shoes and they were at that point, they're lost because you're not going to be able to get in time. And I think when it comes to a lot of that topic, I don't want to keep saying it. I don't like it. It's whatever. But when it comes to that, lives could be saved. You know what I'm saying? And that part sickens me. And then you see things like, they're never going to sponsor us now, but you see BetterHelp, right?
And we don't
You go
want
to get
that
into a
as a
BetterHelp therapist,
Yeah, ask Cody about BetterHelp.
huh?
we don't want that as a sponsor. I promise you.
Um, but you go to get into BetterHelp and they say, oh, it's affordable, yada yada yada.
$80 a week, whether or not you see your therapist.
Exactly. And I think the minimum when I was looking was $50 a week, and that you only get to see your therapist or talk to your therapist once a month.
That's crazy
Like, that is
because you're
not.
paying $200 a month, and on the back end, right? Like they treat their therapists like crap.
Oh,
They
really?
cap your session time at 45 minutes. So you, even if you meet, say you're on a virtual call with someone for a whole hour, you only get paid for 45
Mm-hmm.
minutes. They pay you $30 an hour as a 1099 contractor for the first 5 hours. After the first 5, it's 35, and it goes up by 5 for every 5 hours you put in after. But that's like, you still have to pay taxes on that money.
Yeah.
And you still have to pay for your own computer, your own internet, and all of those things. They don't provide anything to you other than an electronic health record and a platform to do video calls on. That's it.
So
I got
I'm gonna stand on business.
Year gift from them, and it was a coffee mug.
I'm gonna stand on business and say I am pro telehealth, but fuck BetterHelp.
I am absolutely pro telehealth. I meet with probably 35% of my clients via telehealth, and there are times where I can't meet with clients in person and I meet with them virtually. I am all for telehealth, especially because it really increases access to care. But going off what James said, right, a 3 to 6 month waiting list just isn't realistic. And the worst part of that is it happens everywhere. It happens at government funded organizations like the VA, and there's no ancillary services to make sure that those people are getting what they need in the meantime.
Is it
because there is a shortage of therapists? I'm not delusional.
Yeah.
There are certain pockets that have more than others, but they're not just falling out of the sky. People aren't going to school for it because it doesn't make a lot of money. I have 6 figures in student loan debt, and I make more money than I've ever had, but I've been doing it for 8 years.
Yeah, and it's a recurring theme across healthcare. There are people that aren't going to medical school because of the student loan debt that gets accrued from that, and it will take them 20 years to climb out of it. And what's the point in going into a career path where you're supposed to set yourself up financially for ever when you can't even reap the rewards of that hard work until you're in your 50s?
And that's getting an MD.
Mm-hmm.
Like, most of these people that are CEOs don't have an MD. I don't even think they have a PhD. Maybe they have an MBA.
Yeah.
And
maybe
it's just wildly inaccessible, and it's not evenly distributed across the board.
No.
The finances that go into healthcare, because it's not just premiums from private insurers. The government gives them money too.
Correct. There's subsidies involved. Yep.
Right. So they're getting money in 3 different directions,
and this has been a big argument of mine. I'm obviously a proponent of single payer healthcare. We already pay. We already pay. Yeah, sure. The check balance says Medicare, Medicaid, but there is a big chunk of that just federal income tax that goes towards subsidy programs that A, fund healthcare outcomes, but B, fund healthcare research. People who think that pharmaceutical companies, R&D, what the fuck is the term? Is it fake limbs? I can't think of the term. Like those kind of companies that push
bioprosthetics.
Yes, bioprosthetics. The companies that push the edge, that like all of that R&D is funded by us, and we don't reap any of the rewards. Every single, I think it's not
funded by the U.S. military.
Well, that, or it's funded by us in terms of state-funded colleges. Like the vast majority of research institutions are state-funded colleges.
Yeah, but both those places get their money from the taxpayer.
Correct. And then they come up with the patent, they come up with the innovation, and then I don't know if you guys knew this. I think I might have mentioned it to you, Cody, but I think it's 92%, we'll round down to 90% of operational R&D costs for pharmaceutical corporations has nothing to do with innovation. It has to do with extending patents. So you get a certain amount of time. Obviously, we all saw that Viagra went, generic, and then we got Hims.com. So those medications, they go generic after a certain period of time, and the only way to extend that patent is to come up with a new style of
formulation.
Well, it doesn't even necessarily have to be a new formula per se. It has to be it can be a new form of administration. So for instance, if you were able to inject it,
versus take a pill,
or they could have a slow release version, blah blah blah. So that's what the vast majority of R&D is in pharmaceutical corporations. It's just extending the patent so they can have the right to the drug.
Right, which then they are allowed to charge these insane amounts of money, which once again, right, like health insurance premium. So to give some personal experience, my deductible is $3,000, and I pay $150 a month in a premium only because my boss covers the other 80%.
Which is rare.
Right. And the other part of that being, I have to hit all 3,000 of those dollars of in network. Out of network is $5,000, but I have to hit all of that money before they're going to cover anything. The only thing that's covered is preventative care. But what they don't tell you is, oh, I still have to pay for the blood work. I still have to pay for this. I still have to pay for that.
Yep.
And like a med that I see clients on, maybe not too frequently because it's not the most common ADHD med, but it is certainly one of the more effective ones, is Vyvanse. Vyvanse has a patent, I think, until 2037.
Right. And
$360 for a 30-day supply, unless your insurance is willing to cover part of it, which most people have high deductible insurance because that's the way we've trended towards the last 5 years.
yeah. Well, it's
Or unless you use GoodRx, which no one should be sitting in line at the pharmacy trying to figure out how they're going to afford their medication.
correct. And it just struck me. I lost it.
I'm sorry.
It's okay. No, it's not your fault. It was literally like as my mouth said "and," it just plummeted out of. Oh, okay. So you said it's back to me now. What's the James? What's the number one issue with? I guess with I don't say number one issue, but the number one thing, at least in terms of my understanding of truly conservative politics, and that is like liberty, right? The ability to make your own choices based on your decisions and your information, right?
Yes.
So the irony of these insurance companies is that they apparently get a say in a conversation between you and your doctor. You present a healthcare situation to your doctor. You have a discussion. Your doctor runs tests. They determine a situation, a healthcare event has occurred requiring treatment, and then they push that treatment to payment, and then the insurance company says, I don't think you needed that. That's not a thing that you really needed. We're not going to pay for that.
You want a good example of where this plays out pretty frequently?
I'm sure in your office.
Not necessarily in my office, but in gender confirming surgery and healthcare.
Yeah.
Plenty of insurance companies
You
have
know where-
denied people surgery, which arguably would decrease the amount of time they spend in an office like mine, would decrease the amount of time they're at a primary care physician's office, would potentially at some point decrease the amount of medication they need to take to maintain their depression. All for, let's say, double incision mastectomy, which is often referred to as top surgery, is about $10,000.
Yeah.
You can't spend $10,000 once to save yourself what would amount to, let's say, $100 per therapy session once a week for $5,000.
Because insurance companies categorize that as
$200 more. And then we're talking medications and visits to the primary care physician's office and or other medications because that person might or might not have suicidal ideation. It's
right.
ridiculous.
Yeah, and it's because insurance companies determine that that's a voluntary elective plastic surgery.
Correct.
James, you were going to say something. I heard you try to jump in.
Yeah. Actually, I ran into this recently with my sleep study. My doctor noticed something in the blood work. She's like, "Hey, nothing serious, nothing to worry about right now. I want you to do an at-home sleep test just to make sure you don't have sleep apnea." Okay, cool, whatever. Did that home sleep test. My O2 level dropped to 82.
Jesus.
Put in perspective, at below 86, you start doing brain damage.
Yeah.
Right.
My O2 level dropped to 84. Sorry, 84. 2 or 3 times during the sleep.
Yeah, which would be significant periods without breathing.
So, yeah. So in my head, that's absolutely justified. Like, you did that home sleep study, you found an issue, they were going to try and fight me on going to my pulmonology to get it addressed, as it's not medically needed. No, I have sleep apnea. Thanks, friends.
Right.
I mean, it would also cost less than you sitting in a hospital being on life support because you lost enough oxygen to your brain that you could no longer control bodily function.
Yes. Granted, I want to put it in perspective. It wasn't that long that it was at that level because obviously your brain wakes you up,
Right.
but it's still long term. That's not good.
No, because it's just
not
like you
at all.
said, your doctor saw something in the blood work, which means this has been occurring long enough for there to be biological and chemical reactions in your body that are negative.
Right.
Mm-hmm.
Which does not happen in a
And it
short
made no
period of
sense
time.
because it was after I had lost a bunch of weight. I was like, it doesn't make sense, but okay.
Yeah.
So, those are the things that I sit there and, like I said earlier, I'm on the right side of the aisle. I believe in capitalism. I think greed has taken it over and ruined it. But at the same time, like that stuff happens, and I'm like, they're doing this to me, which luckily between me and my wife, we're middle to upper middle class, I guess. Um, so I can afford to pay that bill if I need to. What about Joe Schmo down the street who has sleep apnea? Because mine was considered mild.
Mm-hmm.
What if he has it worse than I do?
Mm-hmm.
You know what I'm saying? Like, and it's either you go to the pulmonologist and you get this solved and you can be happier. And there's more to it than that. Like, not even that. Like, I could sleep for 12 hours and wake up and feel like I slept 2 hours.
Yeah.
So that amount of sleep, or that sleep isn't, you're not reaching your full cycles. So
Right?
that
Your
plays a
body's not healing, it's
factor
not
into
restoring, it's not doing any of the things it's supposed to be doing while you're sleeping.
exactly, and that can play into your mental health.
Yeah. Well,
Because
and
I know, like, when I'm exhausted, I'm more anxious, I'm more on edge, my depression's stronger. It's little
you,
things like that where you're not only helping your physical, like your physical body, you're helping your mental health. You're helping all these things that you don't need to go to the doctor as much.
right.
So you're not spending, your insurance isn't actually spending all that money, but they want to they want to fight you
Nickel and
tooth and
dime
nail
you.
on this one thing.
Yeah.
Yeah, it
Well,
makes
and
no sense.
the other part of this that's crazy, right, is it has caused generations of traumatic responses about going to the doctor.
Mm-hmm.
My grandfather is a great example. It literally took him not being able to go to the bathroom by himself in his own home for him to let us call an ambulance to get him the care he needed after a bunch of other things went wrong, because he just expected that my mom would be able to manage it and was afraid of hospitals and afraid of the bills associated with the ambulance and the hospital and all sorts of other things. And if that's the mindset of someone who can't make it to a toilet 10 feet away, that's a problem.
Correct.
I think a lot of the problems we're having too as a country, like you can track things, and I think a lot of the problem is it's the insurance companies and big pharma. I think those are the problems. Um, you look at things like Adderall is a chemical cousin with meth. So you sit here and you're prescribing these kids Adderall who are just kids. You know what I'm saying? Like a kid is going to be wild. A kid is going to want to run around. A kid is going to have an imagination and just be very fast paced. It's being a kid. And now we're hooking all these kids on Adderall because they sit down, the kid can't focus because the kid's a kid.
Yeah, there's absolutely an
They have shorter attention
overdiagnosis.
spans. It is what it is.
There are
Yeah.
kids with ADHD,
And
100%
they,
that should be on it, but there's an overdiagnosis issue.
Well, and
oh yeah, but then you're throwing these kids on Adderall. Then they hit 18, 19. You're like, okay, we're going to take you off now.
Listen, man, I got my bachelor's degree in
What are these
Adderall.
kids?
Sorry.
But you're addicted to it after that long. You know what I'm saying? Like there's an
yeah,
addiction level to it.
Yeah.
So now we got these kids hooked on pretty much meth. They take them off it. Now they got to go find that drug that fills that spot. And that I think that's why we see a big rise in the like the illegal substance issues that we're having in this country.
Well,
I
yeah.
think that,
It's
and we don't
all
allow access to mental health care, right? The other part of that being is those kids could absolutely learn behavior modifications to help them adapt to a world that is not fit for neurodivergent people with ADHD. But since there's the stigma and inaccessibility to help, like mental health care, that's not happening.
Yeah, and you could say on top of that, um, there's been a plethora of negative healthcare outcomes that have occurred from what I would probably view as incentivizations by big pharma to prescribe their specific medication. Obviously, we just had the Purdue family found, I believe, found guilty. They
Of the opioid
Yeah,
epidemic.
the opioid epidemic. There was some fucking stupid settlement where I can't remember what happened, but it
Right,
wasn't
but
good
it's
enough.
never
But
enough. That's the other part of the problem is all these settlements are
yeah,
never
and
enough to
then
cover the actual cost of the problem.
and then on top of that, we've been overutilizing and overprescribing antibiotics to the point where there is a plausible future in which antibiotics are no longer viable, and we end up going back to a pre-antibiotic era because we've developed so many antibiotic resistant strains of bacterial infections. Obviously, the most common place for that to occur is in a hospital, but it can spread outside of that because that's what bacteria do. They mutate, and
Right.
and that occurs from overprescriptions, and it's. I personally believe it's all driven by a profit driven healthcare system. Um,
Yeah. I mean, I have a friend
and I think
who lives down here who every time she goes to her doctor for an annual checkup, if she mentions anything wrong, they send her an additional bill for whatever she talked about that was wrong, which is fucking insane. Like you asked me how I was doing and I told you and you billed me more.
not to mention it's an annual checkup. It's where you're supposed to go over that stuff.
Right, and it's supposed to be preventative care. And in what world is that not some degree of medical entrapment and it probably poor ethics on the doctor's part, if I'm being honest. But billing someone more because they have a concern just doesn't make any sense, especially if you're not doing any outpatient surgery or prescribing any medication or doing any other testing or assessing. If all you're doing is asking a question and you're billing more, A, how is that moral? How is that person supposed to trust you when something's actually wrong?
right.
And in what world does that make sense for an appointment you're already going to that you didn't make in addition? Like that'd be like me going for an annual checkup and be like, yeah, doc, I'm anxious about the state of the world and climate change. Be like, oh, that's gonna be an extra $400. Like
Right.
I didn't
Yeah.
ask for fucking an avocado and bacon on a sub.
That's a highbrow joke.
Crazy.
No, but
That's a
four
highbrow
hundred
joke.
$400 in a medical place for a sandwich would be pretty nice.
Yeah.
Um,
You wait
but
till you see
like,
the cost of
and
your
then
fucking baby, dude.
uh,
I'm crying on the inside for you.
sorry, I'll be crying on the
You
outside when the bill comes.
wait until you see the itemized bill and they charge you to hold your own baby.
Thank you. That brings up another great point. The other part of this is hospitals often double bill.
Correct.
Will put duplicate charges on a bill, and unless you know what to look for and call and argue, you're just expected to pay that. In what fucking universe are you billing me for the same thing twice? If I pay for one thing at the grocery store and they charge me for two, you best believe I either want the second thing or want my money back.
So, given everything that we've talked about, do you guys, either of you think that there's a way to like reform private healthcare? For example, one thing that I love to use, and it's a win. And I don't care what side of the aisle you're on. It's a fucking win. The Biden administration capping the cost of insulin to $35 is a mega W. The fact that it was a free patent for all intents purposes, the person
Sold
who
for
just
$1.
sold it for a
A
dollar,
dollar.
and then you had fucking Pharma Bro selling it for $2,600, capping it at $35. Like, do you think that's a viable strategy to maybe the government could come in and cap premiums, or not premiums, deductibles, or do you think it is some sort of like hybrid solution, or do you think that maybe we should just say fuck the insurance companies and move to like a single payer system and kind of see how that goes?
I think no matter what we move to, there has to be some degree of oversight. And I'm not saying it's necessarily the government or an agency that they create, but there has to be some degree of oversight to make sure that, and we do some degree of this now, but there has to be oversight to make sure that people are receiving quality care and getting what they actually need. And these places aren't also billing for things that they're not providing. So, like, an example of this is there's a nursing home down here where a resident jumped out of a window. And in what world are we expecting that to be the quality standard of care? But to go back to the actual question, right, there has to be some degree of oversight of what is this going to look like? How are we going to do this? What's manageable? And how do we accurately communicate to any tax-paying citizen, hey, these are what these changes are in your taxes, and this is what they do for you and everyone else, instead of, oh, well, we're going to raise your taxes, and not having a conversation about what that looks like, what that gives access to.
Yeah, I would love an itemized tax bill.
I, I would love to see where I honestly would care less. I think that's one of the things I like about the school district I live in is anytime they ask for an increase that is outside of like what is considered normal, they're like, hey, these are the things we need this money for. You get to vote on whether or not we increase your tax bill by this much, but this is what we're going to spend the money on. And this is how long we intend to use it and what it intends to look like. And they give you a whole fucking plan for what they're going to do with your money,
Yeah.
which is great. But if we do government funded healthcare, great. How do we make sure that everyone's getting access to good quality care? There isn't these 3 to 6 month waits. There has to be a solution.
Right. You don't. And I.
So
Yeah. Go ahead, James.
so I don't know Cody, where exactly you stand on that. Like I don't know if you're pro single payer, if you're, government funded. Um I look at things like the VA, government ran, it's god awful. I don't think the government should be involved in healthcare. If you want to set regulations and caps like Biden did with the $35, was it 35 or 25 for insulin?
$35 cap on insulin.
That I'm all for because insulin costs $2 to $3 to make. With
Right.
the amount you sell, it's ridiculous.
Mm-hmm.
So I think regulation from government is a positive. I don't
Yeah.
want government run. I've seen our government's a shit show. The
Right. And
government shutdown happens. Now we got grandma and grandpa dying in a hospital. None of that. I don't
right.
want
I don't
government
disagree with you.
involved. Once government gets involved, you're you're handing over the right to say this is the government's now telling you what you can do with your body because if they're going to foot the bill, they're going to have a say.
I mean,
So, and I
we
look
already
at
do that
like,
anyways. But yeah,
yeah, and I think government needs to stay out of people's bodies.
I agree.
Um,
Clap, clap.
the
Absolutely.
government needs to the government needs to say, hey, listen, like if the government like, and even doctors as a whole, you know what I think would help a lot with this when you so I I guess I have one class left. I'm not going to finish it because it's a long story. after the kid's born, I'm going to school for something different. But I have, we'll call it an almost associate's in paralegal.
Mm.
When it comes to paralegal, when you take the bar, when you do all that, there is a code of ethics that you have to follow.
Yeah.
I think we should have a code of ethics for medical fields,
Well,
and
We
not
do.
even just doctors.
isn't that
And I'm not even,
isn't
but
that the
like
Hippocratic oath?
above and beyond.
Correct.
Yes,
Hippocratic
I'm
oath.
talking above and beyond doctors.
Oh, like for insurance
Um,
companies,
insurance
healthcare
companies,
providers, we'll say.
Right, and that does
healthcare
cover
providers,
most
insurance
people
companies.
in the medical field. It just doesn't cover insurance companies and the other people, right? I'm still obligated to all the things that a doctor is obligated to do in terms of providing care for a client and making sure that I'm not harming that client in any way, shape, or form.
Yeah,
That exists
but I
across all
think
of the medical
there should
professions. It
be.
just doesn't extend to insurances.
But that's what I'm saying. It should extend to
Mm-hmm.
Yeah.
big pharma and all them. There should be code of ethics when you're doing something like this that has such control over people's lives.
Yeah.
There should be a code of ethics that has to be followed, or they can take it away. Whether it's like a board of medicine, which I mean, I think there should be a board of medicine anyways, because if you look at
There it is.
these drugs, like
There
how
is.
was Adderall ever given? Why don't they follow that ethics? Is what I'm saying. You know what I'm saying? Like it should extend to that
Well,
because
now you're getting
you can't
into
tell me.
you're getting into the deep. I don't want to say. I don't want to use the word corruption because I don't like using corrupt when I'm referring to academics. But there is a paradox in especially in medicine where companies fund research to support use of their drugs, and when you're funded by that company, it's really hard to not try and find the outcomes that they want. So I don't think, and I obviously can't say because I'm not in their heads, but I don't think the FDA and various state ethics boards and healthcare provisional boards are allowing the prescription of Adderall because they just fucking think it's cool. I'm 100% certain that they are given probably privately funded, most definitely privately funded research to support the positive healthcare outcome of the use of Adderall, which is a problem.
Well, and the other thing,
Yes,
right? Go ahead, James.
but what I'm saying is knowing that it is a chemical cousin with meth. Why are we? Why? Who allows that? I guess is what I'm trying to say. Because you wouldn't give a 2-year-old kid meth to have him relax. You know what I'm saying? Like
Yeah, but
there's
like
lines, and I think
the chemistry involved with
when it
that
comes to
is
money, it gets blurred.
well, yeah, and also the chemistry involved with that is a little different. Like if you add an extra, oxygen to water, it becomes poison. So like,
Yeah.
but that would technically be a
Yeah.
cousin to water. So with
Right. When you
chemistry,
change a chemical structure, it changes quite a bit, even
Yeah.
if you change it minutely.
because
And
I've done Adderall, it ain't meth. It's a
in the most part.
chemical cousin, but it ain't meth. Because I can tell you right now. I mean, granted, I've never done meth, but I assume it doesn't turn you into a studying wizard like Adderall did.
I mean, it might turn
No,
you into
but
a wizard, but a different kind of wizard. And I think to clarify, James, I like the single payer system probably the most of the current systems that exist elsewhere. I do think there is just a strong need for oversight because, right, the propensity for capitalism to have such a power and financial gain to corrupt decisions.
and that's exactly what it is. Capitalism was this isn't what capitalism was meant to be.
No,
No,
I think we
capitalism.
this
can all
isn't
agree on
free
that.
market, laissez-faire capitalism.
Capitalism. I knew capitalism in this
No.
country was dead when we bailed out companies that were failing because they're quote too big to fail. Nah, bro. The free market. If you
Like
die, you die.
Banks or airlines.
Yeah. If you die,
Mhm.
you die. That's the free
Right.
market.
R.I.P. Blockbuster.
Yeah, dude. We let Blockbuster
But
go, but we can't let
Yo.
Freddie Mac go. But Blockbuster's got to die. Nah, fuck out of here.
Right.
so it,
Or
but
like
that's
Southwest
the thing. Like
Airlines.
yeah, and like that's the thing. Like when I say capitalism works, not now, because capitalism has been it's been taken over by greed.
Well,
So, and that's the thing I run into a lot of, like, when I argue with conservatives,
Mhm.
which blows their mind when I say, hey, I lean right, and I'm actually more on the right than anything. Um, Capitalism does work, but not when it's made into power hungry, buying each other out all the time. And that's, I think, a lot of I mean, we're going to get into this, I'm sure, in another subject or another topic, but, like, to me, capitalism would work if it was done the way it was intended.
Mm-hmm.
You can't bastardize a system and then say the system's broken and system doesn't work. This is capitalism, because it's not. It's not. And it's greed. Greed and American greed has taken away from America, and it's taken away some of
Right.
the American dream. Like, there's so much to the greed of this country and the greed of people who are making billions of dollars a year. It's one of those things where I sit back and I go, this is part of the reason why I'm leaving the Republican Party and going independent, because people, like, you can't have a system work if you hold on,
Bastardize.
bastardize it to the point where it's not that system anymore. Because this isn't capitalism. This isn't what we're living in. Isn't capitalism,
Right. That's like
No, we live in a
and that
corporate
needs to be
welfare state.
fixed.
right. It's like grabbing a
Yes.
VHS tape, ripping all the actual film out of it, and be like, "Oh, why isn't it playing the movie?"
Yeah.
Like,
Yeah.
because there's no film,
So
Yeah.
man.
I would like to take the final couple of minutes here because we're coming up in an hour. And I'm going to give the floor to each of us, and I would just, I guess, give me your utopia of healthcare, given what you know about what works and what doesn't. Give me what you think ethically, not ethically, ethically is implied, feasibly. What do you think feasibly could work in the American healthcare system? I'll give the floor to James since he was already on a tangent.
I'm going to go back to just what I said. I think having a not-for-profit run system, and I know it'll never happen, but we need a system where the system works for you, you don't work for the system. We need affordable at the end of the day. We need something affordable for everybody,
Mm-hmm.
but I also don't want to hand those reins over to the government, because the government is just as broken as everything else.
Mm-hmm.
And I
Yeah.
think if you give the US government the opportunity to run healthcare, it's going to be a huge, huge mistake.
Well,
I think,
just yeah. Sorry.
good.
I was just gonna say, like,
Um,
I agree with you. I just think someone overseeing it and then it being a non-for-profit. I think the government has got enough of their own shit to deal with that they need to figure that out first before we trust them with anything else.
yeah. And it's one of those things where I think regulation helps.
Yeah.
Like with dropping the prices of insulin, there's no reason that somebody should have to save part of their insulin or use like half of what they need. They need this to survive. This isn't something like, something where somebody made decisions along the way and it led to this. They didn't choose this life 95% of the time. They want, there is, what is it, type 2 diabetes, where it's just because of your weight. But a lot of times that has underlying things that have caused that.
That has to. It could
So,
also be caused by the fact that we have so much sugar in our food. But I digress.
Mm-hmm.
yeah, yeah. Well, there's so much chemicals in our food anyways that it's all problematic. We
Yeah,
will
that's
discuss that
another
on
one.
another episode.
That's only episode 2.
Yeah. Um, there's just so many problems in healthcare that I don't know that we can fix it without starting the system fresh. I think regulation is a huge, huge part of it. When you start saying, like, hey, why is your CEO making $15 million this year? but you're upping premiums.
Mm-hmm.
There should be a cap on that. Okay, your CEO makes $19 million this year. Guess what? You have to drop premiums. And you'll see that money going to the CEOs going down. There's got to be a way.
Ideally,
There's got
yes.
to be a way to take the greed and the money out of something as important as healthcare. When
Well,
it
and
comes to
capping the
like if
CEO's total salary, not just a salary, and then whatever the bonus is completely allowed. Because
yes,
to bounce off what you're saying, I just don't want. Oh, you have to decrease premiums, so everyone who works here isn't going to get a cost of living increase, but the CEO gets a bonus.
yeah, total salary.
Yeah.
And they need what we need is so this is kind of we'll link it together. Back in the 90s, there was investigative journalists who went into Willowbrook and saw the way people with disabilities that were being treated, right? And it brought about that reform because it showed you the inside. We need some type of regulation from top down to go into these companies and figure out why this is so expensive. Why you have to pay $300 a month for insulin when it costs $2 to $3 to make, and let
Well,
that out. Like we need to take off the blinders. If you want to charge, you know, $80 a month after insurance for pills, how much does it cost to make that pill? Can someone make it cheaper? We need to, and I understand there's patents and stuff involved with medications, but maybe take that away. Because if my Lexapro is going to cost me $50 a month, but another company is like, we can make it for $5, we'll sell it to you for $20 a
and
month. And that's what capitalism was meant for.
Mm-hmm.
That's where capitalism works. If you want to
yeah,
charge $55, that's fine. But Joe Schmo down the road is going to charge me 20. Guess what?
yes,
I'm going to Joe Schmo. Now Joe Schmo's making more money and he's got twice the business.
right.
That's how capitalism was supposed to work, to keep prices down. But greed ruined it, and now it's back up to where they're all in cahoots with each other.
Yeah. I mean, I think my utopia is just overall accessibility increased, and that's not just like access to a quality provider near you. It's also access to things that are affordable. There's no fucking reason in hell anyone should be paying $50 a month for pills that cost $3 to make and ship. Especially considering like another
No
good
reason.
example besides insulin is EpiPens. $300 without insurance. And that's only what you would have to pay out of pocket to get one at the pharmacy. A hospital will bill you $600 for a singular EpiPen injection. I You think people chose to be born with allergies? I'm blessed to not have any food allergies because I don't know that I would be able to keep myself away from whatever the hell it was. But it's it's ridiculous. I think my utopia is a drastic increase in accessibility with monitoring and sanctions for people who try to jack up the price or try to remove accessibility or try to deny people quality care because there's just no reason that should ever happen. Access to adequate health care should be a basic human right. The other part of this is right in my utopia. There is a particular program called HAES, and it stands for Health at Every Size. There are a lot of times when people who are in larger bodies are denied access to quality health care because they're just continuously told to lose weight, even though that might not be the sole issue going on. And they might not be able to lose weight due to a thyroid condition that the doctor hasn't even considered. My utopia is overall accessibility increase and doctors and providers, whether that be dental hygienists, ophthalmologists, therapists, whatever, where they actually listen to what's going on with the client, patient, whatever terminology fits in your profession, and actually work towards trying to improve that person's quality of life. It should not be about, well, the insurance is going to do this or they're going to question this. If it's genuinely going to improve the person's quality of life, why not try to make it happen?
Mm-hmm.
Obviously, there are barriers and restrictions on that, right? You're not going to, give someone uh, enough ketamine for ketamine assisted therapy to like get lost in the woods for 15 years, but if it has the chance and has been statistically proven to improve quality of life, why not provide it? Because the pursuit of happiness is a basic human right, so I don't understand why this isn't lumped in with that. And I had something else and I forgot it. But that's my utopia. There should be no reason that people shouldn't have access to medical care, whatever that might look like, that will improve their quality of life.
Amen. Yeah, I guess I'll give my piece. I don't have pipe dreams, nor do I necessarily think that the universal model works. I think Canada has issues with wait times and access to non-emergency procedures, including essential procedures. For instance, like ACL repairs, hernia replacements, those kind of things. The NHS, National Healthcare System of the UK, is in shambles, and that goes to the trust of government. I think that the reason Canada does fund their single payer healthcare really, really well. It's a priority. They're really proud of it. But it has obviously issues with long waits, and so they're a much smaller country than us. So I can't even fathom what it would be in the U.S. if that be the case. On the opposite side of the spectrum, the NHS is woefully underfunded and has been, just torn down for decades of Tory rule, and so that's a reciprocal factor of that. That's a real issue that we could encounter in the U.S. Both parties are fond of leaving healthcare on the back burner. Obviously, the AHA by Barack Obama, Affordable Care Act, Obamacare, as it was fondly referred to as, it didn't really do much in terms of funding healthcare, but it did do a really good job of government oversight, which is what we talked about as like a really good kind of balance. It obviously made it so that way insurance companies couldn't deny you because of pre-existing conditions. That was fucked up to begin with. It's not your fault that you have a chronic illness, and the fact that you could be denied health care because of that is gross. And I hate that I lived in a country where that was okay. It set the legal foreground for the ability for Medicare to negotiate the price of drugs, which is what got us to our $35 cap on insulin passed by the Biden administration. And so I think my dream is Germany. I don't know how much research you guys have done on the German healthcare system, but it was a really good German car. BMW? Yeah. It was a BMW healthcare. It's a Beamer, it is basically for lack of a better term, your nationalized healthcare is an umbrella, but your private healthcare is the first and foremost thing. So basically, nationalized healthcare steps in to cover what privatized healthcare will not. This will require extensive oversight by the U.S. government in our world where we are profit driven. I honestly think that one of the first things that would need to occur is the complete elimination of public trade option insurance companies, because when you are working for shareholders, you are no longer working for the customer. And in healthcare, the customer is the only priority, in my opinion. Shareholders shouldn't fucking matter. We're talking about people's quality of lives, their ability to survive. And that should be the only thing that matters. And obviously innovation is driven, or I guess competition in price, cost lowering is driven by capitalistic instincts. And so a non-publicly funded, publicly traded insurance industry is what the U.S. needs to be overlooked by the U.S. government to establish boundaries and to develop a fail-safe where if you have exorbitant situations, for instance, things that would drive up the cost of insurance, obviously we went through a pandemic that really affected the insurance industry. Um, Individual outcomes where, like, say you're in a coma, those kinds of patients drive up the cost for the rest of us. If that's subsidized, if you say there's a net cap, like once you reach maybe $10,000 or $5,000, whatever number you want to come up with for a single healthcare solution, then the government steps in and covers the rest. So that way you're still covered by the private insurance company. So you can get that individualized personal care. You can get the coverage that you need to be able to get to the specialist that you want to see. And then there are tiered insurances that allow people with better access to maybe go to like a bougier ass doctor. I don't know, but that's what Americans always want, choice. And so if you have the choice, but via private insurance to go to who you want, and then you have the net safety of the insurance companies to know that they're never going to be losing money because they have the safety blanket of capping what they're willing to pay, and the U.S. government steps in and oversees that. I think that is the most plausible option. It allows the capitalistic nature of competition to make healthcare affordable, to innovate, to come up with more cost-effective solutions. Telemedicine, for instance, AI diagnostics, fully online medical platforms, things like that, like HIMSS, for example. You just get to talk to a dude and say, hey, I can't get an erection, and then they send you generic Viagra and various other things. I believe HIMSS does mental health counseling as well. So it's like,
They do.
yeah, it's a full-on thing, and like that comes from the private sector in competition. And so that's my dream is a German style system where private healthcare drives the engine, and then the airbags are the U.S. government.
Well, and I think there's movement towards that. Sorry, I know we're running out of time, but I think there's movement towards that with, like, there are doctors who are doing a concierge service where you pay an annual premium and then they charge you for other things, but you have access to them whenever.
Mm-hmm.
And I also think the other part of the issue is investing in the people who provide the care, right? Because if someone's not going to go to med school because they're going to have $200,000 in student loan debt, I get that.
Mm-hmm.
And what are we going to do if we run out of doctors? Like, you're seeing this with travel nursing right now. They make so much money to be travel nurses because there's not enough. It's eventually going to collapse the healthcare system if we don't come up with a better long-term solution. That was it. Sorry.
No. I know that was it. I was just waiting to see if James wanted to chime in or something.
No, I actually really like that German model.
Yeah, it sounds nice.
Yeah, it does. It sounds like something that you could, like, you think of how polarized our society is, and it sounds like something where you're like, I could really see that being a win for everybody, where it's not
everyone gets
so much of a bitch fest. Yeah, and obviously, like, there's lobbyists who are going to be like, they want to, like, capitalize on the most profits possible, but in a unique world where everybody cares about the quality of life that humanity exists under, and the fact that we are the wealthiest country in the world and we do not have the healthcare to show it, maybe one day, but that day is not today. But we can foster the change. We can foster the change. Millennials are coming into power, and I really have high hopes for us. I really do. Is there anything you guys want to say before we do our sign-offs?
I don't think so.
No, I think I got about everything I want to say out.
All right, guys. Well, thank you very much. It's been a pleasure. This was a really fun and productive chat. I think we did a good thing here. I think this is going to be the model going forward.
What it should be.
It is what it should be.
Sit down and have a discussion whether you agree or not.
Right.
Absolutely.
All right, then. Well, until next time, gents, enjoy your night. Tell your wives I said hello.
You as well.